Welcome to This Explainer. If you're joining us today, chances are you're a really dedicated pet parent, and, well, you might be dealing with something incredibly stressful right now, watching your dog struggle to urinate. It is just a heartbreaking sight. You see them posture to go, but nothing happens, or they clearly seem to be in pain, and it immediately sets off alarm bells in your head. Well, take a deep breath because you are in the exact right place. Today, we're going to unpack exactly what is happening, what it all means, and how to get your furry best friend back to full health.
Okay, so here's our roadmap for today. We're going to cover 1. The warning signs. 2. Is it an emergency? 3. The diagnosis process. 4. The vet's perspective. And finally, 5. Prevention and long-term care.
Let's dive right into Section 1, the warning signs. Recognizing that your pet is actually experiencing a problem is that absolutely crucial first step. And that's largely because dogs are incredibly stoic animals, right? By the time we notice something is wrong, the issue is often already well underway. And this brings up the exact question running through your anxious mind right now. Why is your dog straining to pee in the first place? Well, it's really important to understand that peeing should always be a comfortable, totally effortless process with a steady and adequate amount of urine. Any disruption to that flow is a really clear signal that something within their urinary tract is compromised. Now, indoor accidents often lead to a very common misunderstanding. Pet owners will notice an accident in the house first and just immediately assume their dog is acting out or misbehaving. But what's actually happening in a lot of these cases is that the dog physically cannot hold it due to intense bladder irritation. It is not a behavioral issue at all. It's literally a medical plea for help. To help you communicate effectively with your vet, let's learn a quick bit of clinical terminology. The medical term for straining to urinate is stringuria. So when your vet uses this word, they're referring to a serious symptom that indicates some degree of disruption in the normal urine flow. Dogs with stringuria are going to visibly posture and push, but they really struggle to produce a normal stream. So beyond just the physical straining itself, you need to watch for a cluster of very specific signs at home. These include frequent attempts to pee that produce only a tiny amount of urine. You might hear crying, whimpering, or just see obvious discomfort. You may notice urine that's pink, red, or cloudy, which indicates blood. And finally, excessive licking of the genital area is a major red flag because dogs naturally, instinctively try to soothe the irritation that's being caused by an infection or a blockage.
Moving right along to Section 2, is it an emergency?
We really need to assess the urgency of the situation here to know if you can wait for a regular appointment or if you need to rush to the emergency clinic right this second. The crucial point is understanding the difference between productive and unproductive straining. Productive straining means your dog is pushing hard, but they are still managing to pass some urine. This often points to a bacterial urinary tract infection, or a UTI. It definitely requires veterinary care, but it isn't always a drop everything and run emergency. Unproductive straining, on the other hand, is when your dog is pushing and absolutely no urine is coming out. This indicates a complete urethral obstruction. Make no mistake, unproductive straining is a dire, life-threatening medical emergency. It requires immediate veterinary intervention to save your dog's life. You see, these dangerous blockages are frequently caused by what veterinarians call uroliths, which is just the clinical term for kidney or bladder stones. If one of these stones lodges in the urethra, the dog becomes blocked. The bladder literally cannot empty, toxins start building up rapidly, and the dog can become incredibly sick or even die if they aren't treated immediately. Resolving this usually requires the vet to sedate your dog and place a urinary catheter to empty the bladder and flush out the whole urinary tract. Okay, Section 3, the diagnosis process. Assuming you aren't dealing with a complete blockage, let's metaphorically walk into the vet clinic together. Demystifying what actually happens during the visit can really help alleviate your uncertainty. When you arrive, you can expect a very predictable 4-step clinical checklist. First step, the physical exam, where the vet is going to check the abdomen for tenderness. Second, the urinalysis, which is easily the most important diagnostic tool to check for bacteria, blood, and pH levels. Third is the urine culture, which identifies the exact bacteria present. And finally, imaging, like x-rays or an ultrasound. And that's done to visually rule out those dangerous bladder stones or structural problems we just talked about. While you're going through this diagnostic process, you might actually hear another piece of veterinary jargon, plaquuria. This simply means excessively frequent urination. If your dog is asking to go outside every 20 minutes, but they're only producing a few drops, they are experiencing plaquuria. It's a classic symptom your vet will definitely note in their chart.
Let's shift gears to Section 4, the vet's perspective. It's one thing to read a list of symptoms, but it's really something else to understand how veterinarians actually approach these cases day to day. Dr. Taylor Bartolek, a veterinarian at Sangari Animal Hospital, brings up a fantastic point. A lot of pet owners mistakenly assume UTI will just resolve on its own, kind of like a mild upset stomach might. But Dr. Bartolek emphasizes that bacterial bladder infections rarely clear without antibiotics. Waiting it out can actually allow the infection to spread all the way up to the kidneys. She also notes that female dogs are significantly more prone to these infections. Why? Because their urethra is shorter, which gives outside bacteria a much faster, shorter path right up into the bladder. So, the crucial takeaway derived from clinical practice is the absolute necessity of a proper urine culture. Vets don't just want to guess. If you use a broad-spectrum antibiotic without a culture, a one-size-fits-all approach, you can easily miss the mark. And worse, stopping treatment early or using the wrong drug can allow resistant bacteria to survive, which leads to a much more stubborn, multi-drug resistant infection down the line. The culture tells the vet exactly which specific antibiotic is going to defeat the exact bacteria sitting in your dog's bladder. And that brings us to Section 5, Prevention and Long-Term Care. Once the immediate crisis is resolved, the focus shifts entirely to you. We want to empower you with actionable, at-home care strategies to ensure your dog's urinary system stays healthy over the long haul. And daily habits make all the difference here. Always provide fresh, clean water at multiple locations. Give your dog frequent bathroom breaks so urine doesn't just sit in the bladder too long. Keep the genital area clean, especially for female and long-haired dogs. Oh, and here's a great tip. Feed canned food or simply add a little chicken broth to their kibble. This is such an easy, delicious way to increase their vital water intake. And of course, make sure you keep up with those regular wellness visits. At the end of the day, our main preventative goal really boils down to movement and hydration. Dogs that don't drink enough water end up with highly concentrated urine, and that is just the perfect breeding ground for bacteria. By increasing their water intake, you're actively flushing the bladder, which helps clear out bacteria and grit much more quickly. This is especially vital if you live in warm and humid climates, where dogs are naturally more vulnerable to bacterial growth all year round. But hey, what if you do everything right and the infections just keep coming back? If a UTI returns 3 or more times in a single year, it's classified as a recurrent UTI. In these cases, you can't just keep throwing antibiotics at the problem. Your vet has to perform a much deeper evaluation to find the actual root cause. They're going to need to look for internal factors that are preventing the complete elimination of the infection, things like hidden uroliths, anatomical abnormalities, hormonal changes like hyperadrenocorticism, or even systemic diseases like diabetes. Well, we have covered a lot of ground today, from identifying the terrifying signs of an unproductive blockage to understanding the clinical necessity of a urine culture. I want to leave you with a bit of a provocative question to think about tonight. Are your pet's daily habits actively supporting their urinary health, or are they inadvertently creating an environment where bacteria can thrive? By taking a proactive look at their hydration, their diet, and their bathroom routines today, you just might prevent a frantic trip to the emergency vet tomorrow. Thank you so much for joining me for this explainer, and here's to the happy, healthy, and comfortable lives of our favorite companions.